Hello, everyone. This is Dr. Mimi Tan. Welcome to this seminar for weight loss surgery and other weight loss strategies. We haven't done these in a while, so I'm excited for everyone who's logged in. We'll start with just a seminar portion where I'll review some of the options that we offer, and then we'll move on and answer any questions that you might have. So at any point, if you do have questions, do feel free to send them directly into the YouTube chat, and we'll answer them at the end. All right. Okay. So I like to start these seminars out with a kind of a simple question, a seemingly simple question. And that question is weight loss hard? And it might seem like a little bit of a silly question to start out one of these seminars with, but I think it's actually an incredibly important question to answer. And I think it's incredibly important because we as a society have really answered this question, and I think we've answered it incorrectly. The answer that we've come up with is actually weight loss isn't hard. Really, all it takes is eating a little bit less, exercising a little bit more. You should be successful. Maybe if you just had a little bit more willpower, if you worked a little bit harder, it should be easy, right? And if you're here, I think you've already seen that before or you've heard that before, but you have realized that no, that's not the correct answer to this question. Losing weight and maintaining weight is incredibly, incredibly hard. All right. And if that's your answer and if that's why you're here, you are actually correct. And I think this is a graph that really demonstrates that. This is a graph from the CDC, and what it looks at is it looks at weight trends over time. It looks at weight over the last 50 years or so. And what it actually looks at is BMI, which, if you're unfamiliar with BMI, that's a ratio of your height to your weight. And we use it generally to kind of uh, categorize people into like healthy normal weight, overweight, and then obesity as well. Now, BMI is certainly not perfect. I think there are a lot of problems with BMI actually, but it's a tool that we will often use again to kind of categorize people into weight categories. Now, what this graph shows us is that over the last 60 years, what has actually happened is that obesity rates have kind of skyrocketed. It's gone from 10% in the 60s upwards of over 40% now. And people who are overweight has kind of stayed at a steady level. But again, the obesity rates have climbed steadily over time. Now, the only reason why this exists is because weight loss is incredibly hard. If weight loss was easy, we would not be seeing these obesity rates climbing. What this also tells me is that most people in the US right now are actually struggling with their weight. Over 70% of the US population is either in this obese category or overweight category. And so you're not alone if you're struggling with weight either. So, why is weight loss so hard then? That's the next kind of natural question to have. And the reason why weight loss is so hard is because there are so many things that go into one, how much you weigh, and then two, how hard it is for you to lose weight. Some of it you do have some control over, right? Like diet, you can have some control over how much you exercise, to some degree, like who is supporting you in your life. These are all things that we have some control over that do contribute to your weight. But one of the huge things that you do not really have easy control over is your biology, right? This is who are your parents? What's your hormone balance? What's your body chemistry look like? These are all things that are somewhat out of your control that are a huge factor in terms of how much you weigh and how easy it is for you to lose weight or how hard it is for you to lose weight. So, I often see patients who come to me who have tried and tried to lose weight for most of their lives. And maybe they have lost weight, or even a significant amount of weight, but then they've regained most of the weight back. And what I tell my patients is that weight loss failure is not a moral failing. It's not because you're lazy. It's not because you haven't worked hard enough. It's not because, you don't have the right mindset or whatever. it's a failure against your biology. It's failure against a lot of these different things that you do not have control over with. And a lot of people who have never struggled with their weight, they can never understand that because they don't have that same problem with their biology, right? Now, what I say is that you don't have easy control over, right? You can't change those things with just diet and exercise or lifestyle changes. But there are now tools that we have available that make weight loss easier. And they level the playing field a little bit more so that you are not fighting your biology as much as you kind of previously did. So this is what I call your medical weight loss toolkit. These are the tools that we have available to you when it comes to losing weight. And they're listed kind of from least effective to most effective, and we'll talk about each one in a little bit more detail. So the first is diet and exercise or lifestyle changes. This is what most people have tried multiple times and kind of have not been very successful with. And the reason why they haven't been successful with it is that diet and exercise oftentimes does not move the needle very much when used alone. On average, with diet and exercise alone, the long-term weight loss that you can expect to see is about 5% of your body weight. So if you currently weigh 200 pounds, what that means is that you can expect to lose about 10 pounds and keep that 10 pounds off in the long term with diet and exercise by itself. Now, while diet and exercise by itself is not a very effective means of weight loss, what is really important to know is that diet and exercise is actually a critically important piece when it comes to losing weight, period. So we're going to talk about some more tools moving forward that do help with weight loss, and they make weight loss easier for you. But diet and exercise is still going to be a very foundational tool that you still need to employ. You still need to be eating the right things in order for those tools to work well. And so I do think diet and exercise, while alone is not a very effective tool, it's still an incredibly important tool to utilize for everyone. All right. Medications. So this is the next tool to talk about. And this has gotten a lot of I feel like exposure over the last year and a half, and for good reason. We've gotten a lot of newer medications for weight loss, and they are now more effective than they've ever been. And we'll talk a little bit more about that. The thing to know, I think, for most patients, though, is that there are several options when it comes to medications. There are both oral medications and injectable medications that are utilized. And they will address slightly different things in terms of how they work. And so oftentimes it does take a little bit of trial and error in terms of figuring out both what you can tolerate from a side effect profile standpoint and what is going to actually work best for you. Again, generally speaking, I'll kind of categorize things into the non-injectable drugs. These are often pills that you take every day. These also tend to be some of the older medications that we've had on the market for a while. They are a little bit less effective, generally speaking. We typically see about a 5 to 10% weight loss with some of those medications. And then we have the newer injectable medications. These are going to be kind of the Ozempic family of medications that you've probably heard about in the last year and a half or so. And these medications, again, they're getting a lot of news because they are the most effective medications that we've seen so far. And they are really moving the needle for a lot of patients when it comes to losing weight. What we're typically seeing with these injectable medications is about 10 to 20%, about 15 to 20% with some of these newer medications. And these are injections that you're going to take about once a week, usually once a week. And so those are the only forms that are available when it comes to that medication specifically. Now, what are some of the pros and the cons? So the pros are that the medications, they're minimally invasive, right? It is just a medication that you have to take daily or once a week. And again, they're becoming increasingly more effective for some people. Now, the downsides of some of these medications, one is that they all do have some side effects. Some patients don't have side effects when they start these medications, but some do experience significant side effects. The other is going to be that right now there is limited supply with some of the more popular medications, and they can also be very, very expensive if your insurance does not cover them. And most insurances, unfortunately, right now are not covering a lot of these medications. And so there is some difficulty when it comes to just accessing some of these medications. The other big question that I have with these medications is what is the long-term durability of these medications? And generally speaking, when I start a medication for weight loss, the intention is that you continue that medication long term. What data has shown is that if you stop the medication, most people are going to regain weight. That doesn't mean that you cannot stop a medication. Right? Because some people do actually keep the weight off, but most people are going to regain the weight when they stop. So, again, I usually start these medications with the intention of continuing them long term. All right. All right, let's talk about bariatric surgery briefly as well. Now, I'm a bariatric surgeon, and so this is going to be my favorite topic. And it's my favorite for a reason. It is the most effective means of weight loss that we have available to us today. Generally speaking, we're going to see about 25 to 35% weight loss with bariatric surgery. And it addresses many diseases, specifically metabolic diseases like diabetes, high blood pressure, and sleep apnea that are going to that kind of happen even without necessarily the weight loss. They kind of are a separate effect of bariatric surgery. And I think this is one of the really great things about bariatric surgery is that it really does improve a lot of these different things for our patients. And it actually prevents these complications as well if you currently do not have these problems. And so that's kind of the best thing about bariatric surgery in my mind. Now, who qualifies for bariatric surgery? Again, a very common question that I get. I won't go into the weeds here, but generally speaking, when it comes to insurance, in terms of like when insurances will cover bariatric surgery, we're looking at either a BMI of greater than 40 or a BMI of greater than 35 without disease, with one of those diseases that we talked about, like sleep apnea, diabetes, high blood pressure. These are all diseases that are related to being overweight. Now, every insurance company is going to be a little bit different. Every policy is going to be a little bit different. So if you do have questions about bariatric surgery, the best thing probably to do is reach out with those questions, and we can help you with that. Now, who actually can benefit from bariatric surgery? That's a very different question than who qualifies for bariatric surgery. That is also something that we have medical guidelines for, which means that these are medical societies where large groups of doctors and surgeons have decided that this is where patients can benefit potentially from a bariatric surgery. And that is with a BMI of greater than 35 or a BMI of greater than 30 with a disease related to being overweight. In my mind, like I had said earlier, BMI is not a perfect reflection of health. And so for that reason, I kind of caution away from using hard guidelines when it comes to talking about bariatric surgery and the potential benefits of bariatric surgery with my patients. It is going to be a fluid discussion. And so even if you don't necessarily fall into these guidelines and are thinking about bariatric surgery, I think it's still worth a discussion with your provider. All right. Okay, so what is bariatric surgery? Now, bariatric surgery these days is going to be done minimally invasively, meaning that we use little incisions to perform this surgery. Instead of one big incision that we used to do many, many years ago, now we make multiple small incisions to do the surgery. And what that means for patients is that has really drastically improved the safety and the recovery times after bariatric surgery. And so nowadays, bariatric surgery is actually one of the safest surgeries that we do. The two main surgeries that we offer here at Eviva are going to be the laparoscopic sleeve gastrectomy, which is where I take out most of your stomach, about 80% of your stomach, and leave you with a thin banana-shaped stomach. The other option that we have is the gastric bypass. This is a little bit more of an involved surgery. I turn your stomach into a small egg-sized pouch, and then I bypass actually a significant portion of both your stomach and your small intestine, and then rearrange your intestine as well. That limits how much food goes into your stomach. It also limits absorption in your small bowel. Now, both of these surgeries are great surgeries. They both do also have their pros and their cons. And so during your consult, we do spend time talking a little bit more about what those pros and cons are and really what ends up being the best surgery for you. There are some people who have medical history where I might push you one way versus the other when it comes to these two options. But most people, I would say, are good candidates for either surgery. And ultimately, the surgery that you choose is based on personal preference when we talk about the pros and cons. All right. One other procedure that I wanted to mention that we offer here at Eviva is endosleeve, or the endoscopic sleeve gastroplasty, or the ESG for short. And this is not a surgery, strictly speaking. This is a procedure where we actually go in through the mouth with a long, thin camera, and then we go into your esophagus and we go into your stomach. And from inside your stomach, we're actually able to suture your stomach down, and we scrunch the stomach down so that the inside of your stomach reflects that thin banana-shaped stomach that you would have with the surgical sleeve. And what's really nice about this procedure is, again, it's not technically surgery. You have no incisions with this procedure. And so recovery time is going to be a lot faster as well. It is going to result in about a 20 to 25% weight loss. This has been our center's experience with our patients, which is really exciting. Not quite as good as bariatric surgery, but a good option if surgery is not something that you're necessarily ready for. All right. Now, I want to also talk really briefly about two common myths or misconceptions that I hear almost every day about bariatric surgery. The first is that bariatric surgery is so extreme, or that it's a very extreme option. Now, I understand where this statement comes from. Surgery is surgery. We are putting you under anesthesia. We are making incisions to do the procedure. But at the same time, I kind of want to reframe how we look at this, right? Bariatric surgery is extremely safe. It is one of the safest surgeries that is done today. It's on the same level as a gallbladder removal or a knee surgery that you have. So if you go to any hospital right now and look at all the procedures that are being performed at that hospital today, bariatric surgery is going to be one of the safest surgeries out of that entire list. Now, with that, you also have to weigh it against the long-term issues and complications and lifestyle factors that are impacted by weight and obesity. Long term, there are so many complications that are associated with being obese that we are saving you from some of those long-term complications with some short-term risk with surgery. It's always a little bit hard to kind of think about things in that perspective, but I think that is the perspective that we're generally talking about when we're talking about bariatric surgery. The other myth or misconception that I hear is that bariatric surgery is the easy way out, or that it is cheating. Now, in some ways, this is kind of true. Like, bariatric surgery is a tool. Medications are a tool. They are tools, and tools make life easier for you. That's the entire point of having a tool, right? What happens with surgery, what happens with medications, is it makes something that is incredibly hard, maybe even impossible for some people. And again, we just make that a little bit more of a level playing field so that it is a little bit more achievable. It still requires work. Like I said before, you still have to eat correctly. You still have to change your life fundamentally in order for you to be successful in the long term with either surgeries or medications. So it still requires an incredible amount of work, but it does make things a little bit easier for you. All right. But it's not cheating. It's not the easy way out. It is simply facilitating the change that you actually want to see. All right. This is a review of everything that we talked about. All right. I think this is a good slide to kind of save screenshot if you're interested. All right. And then I also wanted to just mention, what is Eviva? I've said it a couple of times. I'm a surgeon here at Eviva. This is a weight management center, and we provide comprehensive weight management care to our patients. So what that means is that we have both surgeons here who can do bariatric surgery. We have medical weight loss providers, so providers who will work with you both from a diet standpoint and work with you in terms of medications that might help with weight loss. We have dietitians who work with you, as well as the rest of our team who makes everything happen for us. We're located physically in Shoreline, Washington. Um, that said, the only time that you would actually have to come down to Shoreline is if you were to have surgery with us. Otherwise, we have televisit options and telehealth options for all of our patients as well. And then I think, again, more important than where we are is who is Aviva, who is the team who is going to be taking care of you. And to some degree, your surgeons, your immediate providers, those are important people in that process. But at the same time, I think surgery, when we're talking specifically about bariatric surgery, your surgeon is just the beginning of an entire journey. When it comes to bariatric surgery, when it comes to medications as well, what is incredibly important for long term success is who is supporting you, who is taking care of you, who is teaching you the lifestyle skills to be successful long term. And so it's really about the entire team here. And our team here is excellent. And I think it's really one of the important factors in terms of why a lot of our patients are so successful after surgery or with their medications. And so I think that's an important thing to look at, regardless of what surgeon center that you're going to be working with when it comes to your weight loss journey. All right. So how do you schedule an appointment? The easiest way to schedule an appointment is go to our website, evivamd.com, and then click on the Contact Us form and then schedule with us directly. Right. Okay, that is it. Let's answer some questions. Um, so let's kind of, let me see what we have here. Oops. Okay, so we have some questions online that we got in before this talk, and it does look like most of these questions are about insurance coverage, and whether or not insurance will cover it versus the cost of the procedure. Um, I Yeah. Okay. So in terms of the cost of this procedure and insurance coverage, insurance companies and policies are wildly different, and it is a bit of a complicated process. It requires an entire team to just basically figure out whether or not you qualify for bariatric surgery. So if you do have specific questions about that, please do just call us and we can kind of figure things out for you. We do want to hear from you and kind of work through that process with you, but we have teams that are kind of dedicated to that. Now, there are a lot of patients who come to us who also want to just pay for surgery or medications out of pocket as well. I don't have a price list in front of me for that either. So if you're interested in doing that, that's again an option that we do have. And the best way, again, is to call us and so that we can kind of let you know about pricing with the different procedures that we offer. All right. There's one other question on here that says, that was, can you be 17 and have a bariatric procedure? And that is it's a good question. The answer briefly is yes. We do currently do bariatric surgeries for people who are not over the age of 18, so in adolescence. Now, there are a lot of different factors that we do have to consider when we are operating on patients who are younger than 18. Bariatric surgery is a huge lifestyle change, and so we do want to make sure that we are setting you up for success after surgery. I'm a surgeon. I love to operate, but I'm not doing my job if I don't make sure that you are going to be successful with the surgery that I do for you. And so there is a lot of work that we do ahead of time to make sure that you're going to be successful ahead of surgery. And then there's a lot of work that we do afterwards as well. I'm a little bit more deliberate and involved when it comes to operating on people who are a little bit younger and making sure that they can actually be successful after surgery. All right. All right. Let's see. Any questions? Is there anything that I cannot eat after bariatric surgery? So this is one of the most common questions that I get about bariatric surgery is what can I eat, what can I not eat after bariatric surgery? And the short answer for that is that there is nothing in my mind that is 100% off limits after bariatric surgery. In the immediate recovery period after bariatric surgery, we do have a very specific diet that we ask you to kind of follow. And that is mostly to protect your new anatomy, protect the stomach that's still healing after surgery. After that immediate recovery period, again, there's nothing that I say is absolutely off limits. There are a lot of foods that you should eat with moderation. There are foods that you should be very careful about eating. But again, nothing is 100% off limits. Now, there are a lot of patients who do have certain intolerances that they develop after bariatric surgery for various reasons. There are certain foods that are just difficult to tolerate for some people after bariatric surgery. There's also something called dumping syndrome, which is a result of your new anatomy that some people do experience after bariatric surgery as well, where they do have to avoid certain foods to avoid dumping syndrome as well. All right. Okay. What is recovery time like? That's a great question as well. Um, so this is again a question that I get from almost every patient ahead of bariatric surgery, and it is difficult to answer because it is so different for every single person. Um, Generally speaking, I tell patients that there is an immediate recovery period right after surgery where you're healing from your incisions. Your incisions are painful. That pain improves after about the first week of surgery. On top of that, you might have gas pain as well in your belly. That also takes about a week for that to improve. There's also going to be just general discomfort that you might feel from learning how to eat in a new way with your new anatomy and drink in a new way. That discomfort will sometimes take longer for you to get used to that. And then finally, the big thing that people struggle with after bariatric surgery is fatigue. Most of my patients are very, very tired and have low energy levels after bariatric surgery. It's for multiple different reasons, but that is going to take longer than any of the physical pain to improve and to totally recover. I would say generally about a month or so before you're kind of back to your normal energy levels again. So again, I kind of divide it into like the acute recovery phase, which takes about a week, maybe a little bit longer to recover from, but then longer term, it does take a few weeks for you to feel 100% again. All right. Okay. All right. I think that is all the questions that we have today. Thank you to everyone who joined. I hope this was helpful for anyone who's tuned in. If you do have any other questions, feel free to post them on our YouTube or any of our social media. Feel free to send them to us through our website as well, and we will get back to you.